Merriam-Webster defines depression as a psychiatric disorder marked especially by sadness, inactivity, difficulty in thinking and concentration, a significant increase or decrease in appetite and time spent sleeping, feelings of dejection and helplessness, and sometimes suicidal tendencies. Approximately 20% of teens experience depression before they reach adulthood, and only 30% of depressed teens are actually being treated for it. So why are teenage depression rates so high?
Christine? Christine, are you okay?
Yeah, I'm fine.
Okay.
I met with 4 individuals that are credible to talk about depression amongst adolescents, and they are going to give you their thoughts, professional opinions, and experiences with teenage depression.
By either feeling everything all the time or not feeling anything at all. And I think that's the hardest part, or at least for me it is, because when you feel everything so much, it's like somebody could look at you and tell you that the sky is blue, and you'll freak out. But then there are days that nothing affects you at all. And those are the scariest days.
I would define depression as that overwhelming sense of despair, sadness. It's more than just the blues or a crappy day. It's a pit that you can't seem to get out of.
I would define depression as intense sadness and feelings of hopelessness.
I would define depression as a feeling of hopelessness, sadness. It can be a feeling of melancholy, blue. In my profession, what we really try and do is, if the individual were to come in and say that they are depressed, then we're going to have them define to us what those depressive feelings are. Because for each individual, depression can be and can manifest itself in many different ways. And we don't want to, or in my profession, we don't want to really limit or discount someone's feelings of depression if they don't meet what someone else would say those are the ideals or those are the ideas of depression.
Depression can affect a teen's relationship in a multiple of ways because of when they're sad and depressed, they can exhibit anger. Friends and family members don't know how to react to that, and so they push away, or the students themselves push away because they don't feel like they're worth the time or the energy. So it could really affect a teen's relationship with maybe their boyfriend, girlfriend, or just their friends, and especially their family members.
Relationships that teens have can be affected in many ways. Typically what we see is they will withdraw from friends, from family members, from doing normal routines, and they will try and withdraw, not be as socially active. There can be a decrease in grades if they are in school, a decrease in other extracurricular type of activities.
It's affected everything. When I first started struggling, it affected my relationship with my mom really badly. We used to fight all the time. From the time that I was in 7th grade to the time that it was bad. Like, and I know that was the cause of it. That was the cause of it, I guess. More so than I was just 12. But it's really affected my relationships with everybody. Because I don't talk about things, and it makes me unable to talk about, like, normal things that normal people talk about when they're friends with somebody, or when they're related to somebody, or when they're dating somebody. I just can't talk about things the same way. And so it's affected my relationship with, like, people in my life more than anything else.
Because when you are depressed, you don't trust people with your feelings, and so you can't talk about them, and you shut down. And so as a parent, when you have a depressed child, you are constantly chasing them, trying to get them to open up, and it just causes battles, because the more you chase, the more they shut down, and the more distance between you.
Teens going through their teenage years, I kind of joke and say teens are kind of a cross between a hermit and a 2-year-old, because they're trying to find their independence again, you know, just like 2-year-olds do. But they're also becoming an adult, and they push back from their parents, so they withdraw from them. And so when a teen goes through depression, they often act out in anger towards their parents. It may not be their parents' fault, but they're kind of safe with their parents, so they'll act out angrily, or they'll just withdraw and not talk to their parents. Maybe their parents are too busy. It's a hard developmental stage for teens anyways, and then parents not understanding maybe what their teen's going through, it just divides them even further.
There's going to be less interaction with their parents. There can be what the parents might call moodiness. Sometimes it can manifest itself in anger. It can manifest itself as being resistant. Again, it really depends on what the parent and what the child would define as this was normal, and now we're not seeing this as normal.
So I had found parts of a pencil sharpener, a little plastic pencil sharpener, in a pair of her jeans in the wash, and it was obviously taken apart, and I didn't feel like there was any reason for it other than to hurt herself.
Teens will sometimes turn to self-harm as a way to cope, as a way to control a situation, because they feel like that they are out of control, that they've got no control. It can be a way to control or a way to feel something. The depression, they can feel very numb, and they're wanting to feel something.
A lot of teens don't have the coping mechanisms they need in dealing with depression, so they self-harm, whether it's cutting. It's a sense of control. It's something you can control, and where you feel like you have no control in the environment that you are. It's a temporary release for something that's underlying.
So when I found that, I confronted her, and she shut down, and we spent probably an hour or so just sitting on my bed, and I just every once in a while would ask her what was going on, and she showed me her arms, and We just cried.
And again, it goes back to they don't know how to cope with it, how to deal with it. They're young, their brains haven't developed, and haven't really figured out who they are to know what works for them.
I do want to clarify that cutting and self-harm is one of the many ways it can physically manifest itself with a teen. They can also more typically, in my experience, turn to substance use or substance abuse as a way to self-medicate or numb the pain. If we do have a teen who is self-harming or cutting, that requires immediate action, and we're going to take that very seriously.
The best way to explain it is being passively suicidal. You don't take any steps to actually commit suicide. But some days that would be all that I could think about. Anytime I would go to cross the street, I would hope that a car came and hit me. Or if I were driving home, all I could think about was running my car off the road. I've always wanted to die in some sort of accident. And some days are harder than others. Some days it's all I can think about, and some days I don't think about it at all. But it's still always in the back of my mind. And it's the first answer that I can think of when something goes wrong.
When you find out that your child is cutting themselves, that is the only thing that you can think about. And you are consumed by trying to figure out how you can possibly keep them from ever doing that again, and you find yourself struggling to do the simplest things like buying groceries because they could use a can lid. And so you just want to get everything out of the house that could possibly be used to hurt themselves. And I was actually advised to do that in a way to lock up steak knives and razors and anything that could be used. That really, I don't think that was really helpful to her, because it just brought more of an awareness.
I want it to be an accident. I'd want to die in some sort of accident, because I don't want my mom or my little brother or my friends or anybody to have to live with knowing that I killed myself. I couldn't imagine putting my mom or my brother through that. And I think that that's one of the only reasons why I'm not dead yet.
I think with social media, there's so much pressure on teens already, and there's so much available to them, and so social media enhances that, what you see out there. It's that comparison. Social media, you're not going to put your worst days on there, and I don't recommend that you do that anyways. But all you see is the picture perfect life out there. So it enhances that comparison that we do with each other. And so there's always this unrealistic expectation that we have on ourselves, our parents, our family. And I think social media just increases that.
I mean, I was definitely addicted to Tumblr. I spent all of my life on Tumblr, but it wasn't a distraction. It was very real, and it was very in my face. And it was everything about how I was feeling. And I think a lot of its appeal came from the fact that it was mine, and I could keep it away from anybody that mattered in my life. Like, my mom didn't know about it, my friends didn't know about it, nobody knew about my blog, so it was just very easy for me to talk about how I felt or reblog pictures about how I felt without fear of somebody worrying about me.
Tumblr, what I have read on Tumblr, the things that people write are very dark and depressing, and I guess it can be a good thing to write those things down and get them out. I don't necessarily know that it's helpful to other people going through the same things to put them on a public forum where it just kind of, it's all dark and depressing, and it just kind of seems to exacerbate that.
Like, Tumblr was bad. Tumblr was so bad because all it did was make it worse. All it did. Like, I don't even know. Like, I could be okay and I would sit on my dashboard and scroll and scroll and scroll and scroll until I was feeling like crap. Because it's really hard to not when my entire dashboard was black and white and full of girls that are like tiny and a bunch of quotes from songs that make me sad.
Social media can provide a platform for bullying, for manipulation, for a lot of how teens view themselves and how they feel a sense of worth or not feeling a sense of worth. With social media, it's setting up, or it can set up a way that this is the new ideal and this is how you should act, this is how you should look. And it's really not giving teens the ability to express themselves both individually or regionally.
I definitely wouldn't recommend Tumblr to anybody dealing with depression, at least not middle schoolers. I know that was the worst for me when I was in middle school. It definitely didn't help at all, and I just surrounded myself with more darkness and more sadness than I needed. And it doesn't help. Like, a lot of people say that it helps verbalize those feelings, but you're not really verbalizing it. It's another way to keep it within yourself. I used it because it was easy for me to keep it from my mom or my friends because nobody knew about it. So I felt like I could say how I was feeling without worrying about somebody constantly worrying about me or worrying about how I was doing when I needed somebody to worry about me.
We all want to be, or for the teens, they all think we've all got to look like the Kardashians, or we've all got to talk like this different group or that different group, and if this is what my friends say is cool, then I must do this. So I do feel like social media is affecting not only teens with depression, but teens in general, and unfortunately the broader society in how we interact, how we relate, and how we speak to one another.
Because you look at that person and like, oh, she always has so perfect, her makeup's perfect, her boyfriend's perfect, her grades are perfect, you know, just everything seems to be going for her, and you don't really realize what she's going through in the inside because it's just that glimpse, snapshot.
Do I believe that counseling or therapy helps teens? Yes, I do. And I want to say not just for teens, but for teens and for adults. Counseling can be a very safe place for teens or adults to come in and share what they feel is the issue, is the problem. They can work with a therapist to help discover what's creating the depression or the anxiety.
I have been in and out of counseling for the past couple of years, and I never really found a counselor that I stuck with or that I liked or particularly wanted to tell anything. I think a lot of that has to do with the fact that I just don't talk about how I'm doing. But I also think a lot of it had to do with the fact that I was a minor, and I was always really afraid that if I said the wrong thing or if I sounded too depressed, then either my mom was going to find out or they were going to make me go to a hospital or something. I was just really afraid every time I was in counseling. So I think a lot of that hindered it actually working. I just didn't feel comfortable enough to express how I was feeling. And I feel like that's a struggle with anybody that's a minor that's in counseling, because you don't want anybody to know how you're doing, but you especially don't want your parents to know how you're doing. And I think that's just because nobody wants their parents to know just what they're going through. And I always felt like I was close to my mom, or closer to my mom than I was closer to anybody else. So for me to not want even her to know what I was going through was a big deal. There's a lot of shame that comes with being vulnerable with depression. A lot of it was shame for me. I didn't want my mom to know what I had done.
The counseling did not go well because she was seen for the amount of visits initially okayed by insurance, and then she just told the counselor whatever, lied or downplayed her issues or whatever, and the counselor just said, okay, if she has any other problems, bring her back.
And for teens specifically, it can give them a place to express their ideas without feeling judged. Sometimes when teens attempt to talk about these in either schools, with their parents, with their peers, or with their guardians, there can be a level or a bit of judgment that comes across. And with counseling, depending on the counselor, hopefully the judgment is not there.
Therapy is definitely a more cathartic experience when you actually tell the counselor how you're feeling. I've never been able to do that, but it's just a very cathartic feeling in general you keep everything bottled in for so long, and you find somebody to tell, and even if you don't tell them pretty much anything, those small parts that you do tell them, it makes you feel a lot better. And it's even more so in counseling, I think, because there's less of a fear of judgment from your friends or family, because it's essentially just a stranger that you sit in a room and talk about your problems with. I mean, even if they're not a stranger in the sense that you see them monthly or bi-weekly or however long you see them, they don't have any real tie to your life outside of counseling, and I think that makes it easier to talk to them. But it's still hard. At least for me it is.
There's different types of counseling. There's cognitive behavioral therapy, which focuses on negative thoughts. Because a lot of depression, you have those reoccurring thoughts, I'm not good enough, I'm never gonna meet that standard, just that ideal of perfection. And cognitive behavioral therapy will help a student or a person retrain their thoughts so they're not as negative. And then there's also psychotherapy, and then there's individual counseling where it works on interpersonal skills and the relationships. So there's all kinds of therapy options out there, so I definitely think it helps. It's just finding the right fit for you, because it's not a one-shoe-fits-all kind of thing.